Tonight we're going to talk about something that it seems everyone sooner or later has to deal with.
Absolutely. Sinus infections, they're no fun, Bee. They kind of hurt. And doctors are rethinking how to treat them.
Well, usually the typical treatment would be antibiotics, but it doesn't seem to be that that's the way to go anymore.
Look in your ears first.
The signs of a sinus infection aren't all that easy to spot.
And sometimes it's just part of their, upper respiratory tract infection that's early on in their illness, or it's allergic. It's hard to really tease out, is this something that's, infectious? Is it allergic? And is it really bacterial or viral? 1
in 7 North Americans will be diagnosed with a sinus infection each year. Now, new American guidelines say prescribing antibiotics, which is the standard treatment for sinus infections, won't help 98% of the time and could do harm.
One of the major concerns that we see now with antibiotics is the development of superbugs like C. difficile or Clostridium difficile. And we know that patients who've had antibiotics in the last 6 months, that is a risk factor for developing one of those superbugs.
Dancer and instructor Marcia Crossley-Cohen wishes she could turn back time. Last year, she was prescribed Levaquin, one of a certain class of antibiotics called fluoroquinolones.
I can't go for walks. I'm in pain every single day.
She believes she suffered 2 rare side effects, loss of hearing and Achilles tendon rupture from taking the drug. A recent investigation by Global 16x9 showed Health Canada has received 2,000 unverified adverse reaction reports since 1985, potentially linked to fluoroquinolones. In 2008, the U.S. FDA also ordered manufacturers to include strong warnings about the potential risks. Crossley-Cohen says she was never warned.
The safety information. The safety information is always playing catch up. And in this case, we've known about the dangers of these drugs for 15 years. And still, the drugs are widely used and inappropriately used.
The typical treatment for viral sinus infection is lots of fluid, a sinus rinse, and a mild pain reliever like Tylenol. Sometimes the indication that the infection is bacterial will be that you have a fever, but you should always check with your doctor to have a firm diagnosis of what it is that you've got.
Okay, Bee, thank you for that.
You're welcome.